Dr. Patel.
Yes.
Yeah, great. So tell me a little bit about why dentistry. How did you get started in dentistry?
Well, I've always had a love for the sciences, so I was always going into the medical profession. Dentistry kind of sparked my interest because it deals with both science and art. You know, to tell you the truth, I just did it as a whim. Didn't know if I was going to get in or not, but luckily I did get in. And I just found it really interesting once I got in. You know, I never had a family member that was a dentist. I didn't have really a lot of exposure to dentistry before I got into dental school, but you know, once I got in, I mean, it was hard, okay? I'm not saying it was easy. Dental school was super hard, but after I got out and really applied what I learned and what I'm doing, man, I love it. I don't think I can do anything else.
You know, just talking about that, interesting is, you know, I don't think people really understand what it means to become a dentist. What kind of schooling does that take? What's the time commitment? And then I know you've done additional stuff since that time, additional training. Maybe talk on those points a little bit.
Yeah, I mean, dental school is 4 years, and that's after 4 years of college. So an additional 8 years, you know, of schooling after high school. And then if you want to specialize in something, specialists are anywhere from 2 to 6 years, depending on what specialty you want to get into. If you don't want to specialize, that's fine, but then you're always, you know, learning. You're always doing continuing education. So, I mean, I just took a course last week, you know, so I'm always training myself, learning. You're always learning.
And so talk on what are some of the additional clinical skills that you learned after general dentistry?
Sure. So in dental school, we learn a little bit of orthodontics. You know, we take like a class here and there, but I wasn't very comfortable in it. So that's something I took, some additional courses in orthodontics. We do fast braces and clear aligners, additional courses on cosmetic dentistry, you know, learning how to prep veneers and things like that, courses on surgery, implants.
Which you do both of those.
Right.
Tell me a little bit about that, surgery and implants. What kind of cases can you take and beyond what general dentistry would offer?
We extract, you know, all impacted teeth, mostly. We do all sorts of implants, single implants, multiple implants, all on, you know, all on 4, all on X implants. So there's really not a lot that we don't do in our office. If I can't do something, I do have specialists or other doctors that are trained in those things that come.
Tell me a little bit about your purpose. So obviously you had a purpose, be a dentist, but as a practice, kind of the mission statement of your practice or the ethos of your practice.
Yeah, my purpose is very simple. My purpose is to get my patients healthy. And the way we do it, the way I do it, is through their teeth and gums. You know, if we can get their gums healthy, we can keep their teeth for a long time. And I tell my patients, people that have teeth live at 10 years longer than people that don't.
Which is proven by independent studies.
Exactly, exactly. My other goal is, you know, I see a lot of patients that haven't been to the dentist in a while, and for a couple of reasons, you know. One could be a fear, past experience, and then, you know, possibly cost. My goal is, you know, to have my patients come in more frequently, and we try to make it comfortable for them coming into the dentist.